Hey everyone, how you doing? Today, let's talk about the pinhole technique for gum recession. My name's Gus, I'm a cosmetic and implant dentist based around London in the UK. And recently I've been getting a whole bunch of inquiries from people saying, hey look, I've got all of this gum recession, can you help me? And some people have been specifically asking for the pinhole technique. And I need to start off by saying I know nothing officially about this technique. I've not been trained in it, I'm not a specialist gum dentist, but I do have a lot of experience in handling soft tissue. I've done a couple of really great cases where we've brought back gum using tried and tested techniques. So I'll show you how we do this case, and I'll show you what I know about the pinhole technique specifically, and hopefully Dr. Chow, who invented this technique, won't hunt me down and kill me for giving you this information. You see, the reason I'm saying this is that every delegate who goes on the course who learns about this technique has to sign an NDA, a non-disclosure agreement of what they learn on the course, which then makes it very difficult for people who have not been on the course, paid the money, been on the course, to find out details about it. Now, having such a closed environment always makes me a bit skeptical. Okay, it just seems like the guy wants to get people on his course, doesn't want to release any information and the details. There's no good before and after photos. Well, there is, and I'll show you them in a second. But there's not a lot of information out there about this. Okay, and how it compares to other treatments which are available. So, first of all, let's look at this case which I did, and I'll show you the before and afters here. And I'm going to walk you through exactly what's involved in this treatment. So the first thing that we have to completely appreciate on this case is that the before and afters are dramatic and it looks really good, but a good reason, a big significant proportion of the improvement we're seeing here is because she had 4 veneers as well as the gum recession treatment. You see, to make a smile look good, we have to get the bottom edge of the teeth all looking good in a nice smile line parallel to the lower lip. We also have to pay attention to the tops of the teeth, especially in those situations where patients are showing the roof of the teeth. Now, you can see here, if I just draw on this picture a little bit, this is all fillings. Okay, so people who have gum recession, one of the treatments which is often proposed is to actually use white fillings to take the enamel of the tooth, or what looks like the enamel of the tooth, all the way to the gum. And this works. The only problem is long-term composite doesn't last that well. You can see it's starting to fade. You can see the junction line in between the tooth and the composite. And we need to look at a different way to do this. Now, the way that we did this gum graft here was we took some gum, some of the patient's natural gum from the roof of their mouth, and we transplanted it at the front there. Okay, so I'll show you my exact cuts which we make. First of all, we use a scalpel to make a cut here on all of these front teeth. Okay, actually that's too far, we have to be precise. We leave the middle bit, the pink bit in between the teeth, we leave that alone because we want to maintain as much blood supply into the area as possible. We then put our scalpel away because we just don't need it anymore. Okay, apart from to collect the graft from the roof of the mouth, we don't need it anymore. We then use different instruments, and this is important as you'll see in a minute, to lift away the gum from the bone. Okay, so what we often have is we have the bone, then we have a very thin layer which is firmly attached to the bone, and we leave that in position, and then we've got the rest of the gum. So this instrument, which is actually quite blunt, goes up in the middle of the gum, leaving that bit which is attached to the bone, because we know that if we do it like this, we're going to have the maximum amount of blood supply into the graft and things are going to work nicely. Okay, again, this is just an important distinction, and it will make sense when I talk about the pinhole in a bit more detail. So then once we've lifted the gum away from the bone, we've got a little pocket that we can put stuff in, and then we take the gum from the roof of the mouth and we place it inside and we stitch it all back together. This treatment takes an hour and a half, 2 hours, something like that. It's very technique sensitive. It's a very delicate procedure to do, and the patient is left with 2 surgical sites. So where we did the treatment at the front and where we did it at the back or on the roof of the mouth. And it doesn't really look that pretty. Okay, this is what it looks like 2 weeks after healing. After doing the treatment, 2 weeks later, it looks something like this. And it's very clear that we've done something, and it doesn't look fantastic. But give it another 2 weeks and it's hardly detectable that you've even done anything. Now, the important thing here, and a lot of periodontists, dentists who specialize in gums, will agree with this, is that we need to add thickness. Okay, and by placing the graft underneath the existing gum, pulling the gum down a little bit, you increase the height of the gum, and that's the visual bit, that's the recession that everybody complains about, but also we increase thickness with what we call keratinized gum. Okay, and the gum from the roof of the mouth is very nice because it has a lot of this keratin in it, and it's a very tough gum, which we can use to increase thickness and help protect the neck of this tooth, which protects it from relapse years later. Because you don't want to go through this treatment and have all the gum recession come back. Now, that's how we do a traditional soft tissue graft. Let's have a look at the Pinhole website and let's find out what information we can find about the Pinhole. So when we first log on, we got a nice, lovely video to watch. Again, doesn't really give us a lot of information, and we've got a couple of photos here, so let's have a look. Let's see if we can zoom into this. Okay, we can't really zoom in very well, but you can see there's a hole at the top of the gum. Okay, so there's no direct incision, so they say no surgical, no blades. Okay, and if you remember, I think this is a bit misleading because when I showed you how we do a traditional tissue graft, we only use the blade for the first little bit. After that, it's what we call a blunt dissection, where we're not using surgical blades. And it looks nice. On this case, you wouldn't be able to tell whether it's been done with a pinhole or whether it's been done with a traditional soft tissue graft like I showed you a second ago. Okay, so now we've got the before and afters, and this is where they can show their best cases, really. So we can see the pinhole. I mean, it's not quite a pinhole. That looks like it's almost 4 millimeters across. So it's a decent sized hole, and it's made away from where we want to build a recession. But if you read all of this information, what they do is they make a hole and they do this blunt dissection. Is exactly the same as we would with what we call a tunnel preparation for the connective tissue graft. They're doing the exact same thing, just accessing it from the top in the pinhole rather than from the gum margin, which we do in a traditional connective tissue graft. And then instead of putting the patient's own gum, which you get from the roof of the mouth or from other sites, they're putting in a collagen matrix in here, okay? And the idea is that this collagen is going to support the gum in its new position, okay? And clearly it works. And because of this, they say that there isn't any stitches involved. And you can see the before and after is generally pretty good. This one here is okay. I mean, the patient's still got recession at the end of it. Maybe they can have another technique, but the amount of gum which has been rebuilt is pretty good. It looks good. Combine this with some veneers and these cases will look absolutely amazing. So then I like to jump to the FAQ section. Okay, and we've got here, and I'll put a link to all of this below the video, but we've got here, what is the Chow pinhole surgical technique? And the answer to this question is it's a surgical technique to repair the gum shrinkage through a pinhole without having to cut. So I would disagree with this. We're doing all of the blunt dissection, which you're doing in a traditional tissue graft. You're doing it in the opposite way, but you're still cutting. Just because you're not using a scalpel doesn't mean that you're not cutting, okay? And it's these kind of things, this kind of wording which has specially been put together to make this surgical technique look superior to everything else. This is, in my mind, what creates a certain distrust with it. Okay, from the before and afters, it looks like a good procedure. And remember, it's always in the right cases. So this will only work for certain people. It won't work for everyone. In the same way that a connective tissue graft will not work for everyone. It has to work in a specific case. So to say that there is one technique out there which is going to help everyone with the recession is just untrue. There is nothing like that. So let's go back into the FAQs. And I particularly like this one. Before this procedure, would people rather live with the problem instead of getting it fixed? And the reply to this is, this happens to a lot of people because they're put in a dilemma of whether they should fix it with a very painful, drawn-out gum grafting procedure, just try and ignore it, or a temporary fix with the white fillings, which I showed you in the case which I did. Now, what this sentence is doing is just framing those other treatments as if it's an absolute torture. I guarantee having the pinhole is no walk in the park. It's still a surgical procedure. Having the tissue grafts and things like that, I mean, compared to the stuff which I do, the bone grafting and all on fours and all of that stuff, the tissue grafting is not high up on that scale of pain. Okay, during the procedure, none of this should be painful because you've got profound anesthesia, but afterwards, the recovery phase, you can get pain, swelling, discomfort. Okay, I'm sure you would get it with the pinhole. You get it with the normal connective tissue grafts as well. I also like this one. What is the key to the procedure? So here in the answer, he goes on to say, pinhole is made with a needle. There's no scalpel or cutting at all. Okay, and I've already covered this. I disagree with that. We can literally shift the tissue down with very little trauma to the tissue. So you are separating the tissue from the bone. Okay, that's what creates the trauma. And no matter how you do a tissue graft, that's what creates the trauma. So if you use a scalpel, by the way, is actually less traumatic than if you tear the tissues open, which is what's happening here. And you can literally shift the tissue down, and this periodontists have been doing this for forever. Okay, whether you lift the gum with a flap, which is not what I've spoken about before. Okay, lifting a flap, I agree, is more traumatic, and there is more aftercare. What I mean by a flap is you lift the gum away from the bone completely. There are minimally invasive ways to rebuild gum, and most good periodontists these days will opt for those anyway. Okay, so remember, one is this patented pinhole technique, which seems quite secretive, and I don't personally agree with a lot of the wording which they use on the website. And the other way is just a normal connective tissue graft, which specialist periodontists have been doing for forever and a day. And interestingly, he says that this is the least invasive treatment available in dentistry. You cannot agree with that. You know, I'm sure a scale and a polish is much less invasive than this. And there's a whole bunch of other FAQs, and you can you should definitely research this kind of thing if you're looking at treatments for gum recession. You know, definitely check it out. So my issue with this thing is the same issue that I've got with All on 4 or Invisalign and brand names, because these brands are created so that the company behind the brand can profit from a specific problem. But when people are trying to do their research online, they see this brand and they're like, oh wow, you know, this is what I need. And in reality, there are so many ways to help with recession. If you see a specialist periodontist who does not do the pinhole technique, I bet they will be able to find a good solution for the recession. Okay, if it is treatable. Remember, a good proportion of gum recession is not treatable. So if it is treatable, periodontists who are specialists in the field will be able to find a solution, and it may not be pinhole. And even if you take the most invasive type of tissue graft, I think it's more important that at the end of the treatment, it works. And a lot of this stuff on the pinhole is focused, a lot of the wording is focused on the recovery afterwards, and is framing a conventional tissue graft as being this really evil treatment, whereas this is the, you know, it's the angelic treatment. It's like, why would you ever have anything else when this is just a way of doing it? From what I've seen, what I've spoken with other periodontists who are familiar with this, there's nothing groundbreaking about this treatment. At the end of the day, we're still treating humans, and we have to rely on fundamental principles. If you're doing a graft, you're trying to regenerate tissue, its blood supply is key. You have to maintain excellent blood supply, and whether you're doing it with a minimally invasive traditional tissue graft, or you're doing it, accessing it the other way from a pinhole technique graft, it doesn't matter. It's two different avenues of doing almost the same thing. I would always prefer to use the patient's own gum to rebuild their gum, because this is from lessons that I've learned from bone grafting, which is, if you can use the patient's own stuff, it's always better. You get less complications, you get less problems, the body will heal better. So that's why I always prefer using a tissue graft from the roof of the mouth, even though it adds discomfort for the patient. Okay, this is a big downside in these 2 weeks of healing, is that you will get more pain and discomfort if you have two surgical sites. Same with bone grafting. You know, I see patients who need a lot of bone grafting before we can do implants, and if I can use the patient's own bone, I know we're going to get better quality bone when we go in to put the implants in, and I know we're going to get less complications during the healing. Okay, the implant companies will say the opposite, but remember, they're trying to sell their bone products to dentists. And on the, you know, I was going to say hundreds of courses, I probably haven't been on hundreds of courses on these subjects, but you know, on the good proportion of courses that I have been to, I'm speaking to really experienced surgeons. They all say the same thing. If you can use the patient's own stuff, it's always better. Okay, so I don't want this to be a damning video on pinhole, because I just don't know enough about the procedure. Is it a completely different treatment to normal tissue grafts, which periodontists are doing? I don't think it is. It's just a kind of a brand. Okay, Dr. Chow is trying to make it into a brand. I've got nothing against him being entrepreneurial about this. The whole secretive aspect of it and getting his delegates to sign NDAs, that's, you know, also I haven't got proof of that. This is just what I'm hearing from other dentists who have been on the course. So, you know, it just sounds a little bit suspect. But below this video, I've linked to this website that I'm looking at. There's a whole bunch of dentist websites where you can read more about this procedure, and in the UK there's a couple of people doing it. So, you know, read about it, find out more about it. If you're thinking about getting this stuff done, check out all the different avenues. Just because you've seen some dentist who works in Marlow talk about this on his YouTube channel doesn't make what I'm saying 100% factual and accurate and correct for you. You should try and do as much research on these kind of things as possible. Speak to people and speak to periodontists, get different opinions, and go with the person who you like the most. Okay, so I hope you found this useful, guys. I'll see you next week. Take care.